still watching Prime Morning. Of course, it's time for us to have the big interview since it's a Wednesday. And I'm excited about this particular conversation. Why do I say so? I have a man who has the health sector at heart. And this man, actually, aside having the health sector at heart, he also has his constituents at heart. And so he decided to say, let me put medicine on the side a little bit, just for a short while, serve my constituents, went in there, competed on the ticket of the NDC, and is now the Member of Parliament for Lambusi. He's in the person of Honorable Titus Beyuo. Hello, Honorable.
Hello.
How are you?
I'm good, and good morning.
And good morning. You know, the last time we had a conversation,
Yeah.
I had to call you Dr. Beyuo.
Yes.
Now, it feels good to call you Honorable. How does it feel to hear that, though?
In fact, sometimes I still prefer to just be called Professor Beyuo. But people confuse the titles. It's Honorable Professor.
Okay.
Or whichever way.
So which one do you prefer now?
Just call him Professor Beyuo.
No, we can't take the honorable out.
Okay,
You worked so hard for that
Professor.
one. Honorable Professor. All right, I like that one.
Yes.
And being in Parliament, I mean, what is happening in Parliament? Did you ever foresee that, you know, if you go into Parliament, this is how it's going to be? Or it's quite different from what you thought?
Well, it's a new exposure, but let me greet the very good people of Lambuse who gave me the opportunity to even be there in the first place. So I want to say a very good morning to our Paramount Chief, Kuro Isa Katenje II, and all constituents from Lambuse for being so gracious to me, so kind to me, to send me there. I've gone there as their worthy representative, and I'm determined to do that. And of course, for any new job, when you start, things will look a bit some way to you. Learning what is almost like a contrasting side of what your actual duties as a parliamentarian is and what the constituents expect of you, quite different. There's a sharp dichotomy. You soon realize that you are there to make laws, to have oversight over government, various agencies of government, and then generally contribute to the building of the society and the democracy that we have. But then in the constituency, you're a father of everybody. You're a father of everybody.
So they are homoing you small in Parliament.
Yeah, here and there. Of course, backbenchers, we are there and there. We hope to grow.
You will grow. You will grow.
Yes.
And probably one day you become, I don't know if I should call you the majority, leader.
That's a huge aspiration.
Yeah.
But we've just begun. So we'll see how far God will take us.
And we know you'll do very well in Parliament
do our very
well.
best. We'll do our very best.
And as you are in Parliament, of course, the health sector is also calling on you because with your expertise, you can't just be serving your people in Lambusi. You have to serve the health sector as well. And when I heard that you had won, I was very excited because I knew that, if the NDC should win and having somebody like you in Parliament, we are going to see a better health sector. Now, talking about that, one of the things that I really care about is Agenda 111. On my show, I kept on talking about Agenda 111. I really wanted it to be completed because of lack of hospitals, lack of beds, and all of that. But unfortunately, we didn't see that. Now, as you are in Parliament, what are you going to do to make sure that Agenda 111 is completed?
All right. So I can't talk about the health sector without recognizing what has just happened yesterday. So let me extend my warmest congratulations to the Honorable Minta Akando, Governor Minta Akando, who has been ranking on the health sector for a while, the Health Committee of Parliament. For a while, I appeared before that committee. I've worked closely with him, and I have absolute confidence in his competence. He has grasp of the area, and I'm sure he will do well for His Excellency. So nominating him as a health minister, I think, is apt. There couldn't be a better person. So I really celebrate His Excellency for doing that. Well, for me as a person, yes, Parliament, committees have not been formed yet. I do not know if I'll be on the health committee, but if I am, it will give me an opportunity to have some oversight over the executive arm of government as far as the health is concerned. But definitely I have a say on the health of this country. And I had views, very strong views of Agenda 111 before, and I still do now. And it is that I think is an ambitious project that defied all logical reasoning of project management. You know, when you want to do a project, basic project management principles will tell you that you either test a bit, do like a pilot, see how it will go before you roll it out on a bigger scale. To start 111 hospitals at a go without specified funding was a huge challenge. To start these hospitals and situate the whole thing in the office of the president is even a bigger challenge.
Right.
You know, who is better trained, better equipped, better knowledgeable, with the experience to handle construction of hospitals than the Ministry of Health, where we have the engineers who can supervise the work. So when you situate that in the office of the president, then it's confusing. And then you realize that they tried to start all at a go, couldn't go far. Even the ones that they claim they have completed, unfortunately, are just buildings.
Right. But so for you,
Yes.
when you heard about Agenda 111,
Yeah.
you knew from the onset that it wasn't going to be fruitful. Is that what you're saying?
Definitely.
Oh, right.
And in fact, when they said it was going to be done in 18 months, I said it was just not possible. Then they kept changing the date, confirming what I was saying. And you know, a hospital is more than the building. So Lambuse, my constituency, is a beneficiary of Agenda 111. We have one of the projects there. I welcomed it because a constituency like Lambuse, we do not have a district hospital. So this is a very welcome project for us. But you go to some other places, you will find a hospital there, and then they are trying to build Agenda 111. You go to some places, you find a very vibrant CHAG hospital, and they are trying to build Agenda 111.
Okay.
So, and then I did say that hospitals are not just a building. You have to look at the human resource. And I kept hammering on this point. What was our human resource plan? And I remember engaging Dr. Nsian Sari on several platforms on this issue. And then he will mention figures. It's different from figures. You are building a hospital that is like the level of a district hospital to run multi-specialist services. And you have not planned recruitment of the specialists. So even when the hospital is finished, how do we resource it with human beings to work? So one would have thought that if you have such an ambitious project, you look at the human resource planning. So for instance, do we expand entry into postgraduate medical education?
Okay.
Do we increase admission? Do we train specifically 100 more obstetricians, 100 more pediatricians?
But don't we have enough doctors, though? Because, you know, at a point in time, we had that, especially with nurses, that there are so many nurses who are home, they are not working and all of that.
Good. So you notice I'm not talking about nurses. I'm talking about doctors.
Okay.
But even with the nurses, we have general duty nurses. But we are talking of hospitals that are going to run specialist services. In the medical fraternity, one of the biggest challenges we have is that the most experienced are those that are exiting this country in droves. So you have very experienced nurses leaving. You have consultants, specialist doctors leaving. And then you are putting up hospitals without a deliberate plan to hold these people back. You are not increasing the training of the specialists. Medical schools currently have the capacity to train about 900. They are trying to increase it to about 1,350 medical student intake per year. That is all medical schools in Ghana. So at that level, you may produce a lot. But how many of them are staying? Well, my emphasis is on the specialist level. These are the category of doctors that are going to man these hospitals. Because if you put up that beautiful edifice and you have one medical officer, a physician assistant, and some enrolled nurses working there, it has not lived up to its billing.
Now, talking about, you know, training of professionals and some of them leaving, especially the doctors. Now, one of the complaints is to do with finances. Of course, whatever they receive at the end of the month, they do have problems with it. I remember not too long ago, I think the doctors in Kumasi or something, they had to relocate so that they use their area for something else. Now, talking about that, what are you in Parliament, as you're in Parliament, what are you going to do to support your colleague doctors in staying? Because that's a big thing right now.
All right. So I'll speak on this first as a parliamentarian, a legislator, and also as a member of the National Democratic Congress.
Okay.
I was one of the spokespersons on the health component of our manifesto. And I know His Excellency John Dramani Mahama is committed to delivering on that manifesto. And in 14 days, we have seen that he's been executing most of the things already there, which means he's very committed. He's on record now as the first president in Ghana's history to name a full cabinet in 14 days. It's never happened before.
15.
14.
He did it in 15. Yes, 14 was supposed to be on the 20th, but he completed it on 21st.
That list was ready on the 20th.
But
it
we
was
didn't
sent to
receive
Parliament.
It. Once we received it,
it is not to the
21st.
public.
But you spoke to the public that you were giving it to us
even
in 14 days.
Would be a record,
Okay.
you know, right? And he's done that. So this is a man we are behind. And I'm very committed that he would commit to that manifesto. And so when you look at our manifesto, we have something in there to tackle this very issue you are talking about. The National Democratic Congress is saying that we are going to have a program to ensure ethical migration of doctors and healthcare workers in general. And when there's time, I'll explain that. We're not going to be able to stop people from moving,
okay,
but we must make sure that that movement is ethical. That movement benefits the mover and benefits the society that trained the mover. As it is now, people move on their own. It's not coordinated. We don't even know who is leaving tomorrow. Sometimes you're on duty with someone in the morning, you expect the person in the evening, and then you meet the person at the airport, he's gone. So, and private agencies in the UK and other places are benefiting from this people's movement. But the country that trained them with our resources get nothing. So our plan has been that we must have a coordinated movement where people who want to go can go, and the state is compensated by these agencies that hire them so that we can use that money to train more people. Okay. That is very ethical. And then we look at our numbers. Those that we want to keep, we keep. Now, how are we going to keep those that we want to keep? We are saying that if you're having hospitals like Agenda 111, that we are committed to completing some, you must plan to keep the people there. We are saying we're going to give them a package. Okay. This package will be an incentive that looks at a top-up on their salary as an allowance for agreeing to serve in the village. And then they will have earlier promotions than their counterparts in the cities. They will be entitled to earlier study leave. So if somebody is in Lambuse today and wants to become a gynecologist like me, or a pediatrician, or a general surgeon, to come back and serve the people of Lambuse, there's no business letting that person work for 3 years, 4 years before the person can have the opportunity to specialize. Okay. So they can leave earlier. After being in Lambuse for a year, the person can be allowed to go to school and then come back. And we are thinking of decentralizing this postgraduate training so that you don't have to travel all the way from Lambuse, relocate your entire family to Accra to come and specialize. When you do that, going back becomes difficult because by the time you are done, your kids are in school. So
you want to make it, having it in all regions. Is that what it is?
Exactly. We are going to try to use the regional hospitals as teaching centers to expand the postgraduate training and expand undergraduate medical training. Now, if you do this incentive package, you are not looking at just money, but there are soft ones like the fact that you have an opportunity to go to school earlier than your counterparts in the city. You'll be promoted earlier than your counterparts in the city. Then people will be motivated to go and serve in these places. We also plan to open satellite campuses of some medical universities. And the data is very clear that wherever you've had a medical school or a campus of a medical school, the number of doctors in that region immediately shoot up. You can look at Tamale. Currently, they are not short of doctors. You can look at Ho. Currently, they are not short of doctors. So we are going to do similar thing in the Bono enclave, the 3 regions in the Bono. We're going to use the Sunyani teaching hospital, regional hospital as a teaching hospital for medical, undergraduate medical training. And because of that, we are going to have inflow of specialist consultants into that enclave, and that will translate into improved quality of care in the surrounding communities. Okay. Yeah.
Now, one particular topic that I think is going around this morning is to do with the first year free tertiary fees. Yeah. Now, unfortunately, the professional studies is not part of it. Yeah. Medical field is not part of it.
Yes.
what are you going to do about it as you're in Parliament? Because you need the doctors.
Yes.
But if somebody is from a less privileged home and the person is not going to benefit, we might see a decline in people who want to apply for such courses just because of the free tertiary first-year education.
All right. On the contrary, I didn't think the data supports that assertion. Currently, medical schools are having admissions. If I were not in Parliament, I would be on the interview panel for the University of Ghana Medical School that conducted their interviews last year. My colleagues were on it. If you look at the total capacity, as I mentioned, both private, public medical schools in Ghana, the potential of the country as of today is about 1,350 total intake. The number of people qualified and trying to enter into our medical schools are far in excess of this number. You go to a KNUSC Dental School has a capacity of about maximum of 30 dentists that they can take in a year. They'll probably be taking like 20 or something to manage their capacity. So it means that the people seeking these courses are far in excess. Now, when you go in there, we have government subvented students. These are the regular students who are paying normal fees. Then we have people who are paying what we call the full fees. And then we even have those who are paying foreign fees, those who are not Ghanaians that are coming in. You will have so many people trying to come in through these other routes and are not getting. It is true that there are people who are less privileged, who need help, who need support. There are other avenues through which those people can be helped. There is room to discuss adding that category of people to this free tertiary education. I think the first year tertiary education, it is justified for us to make that call. I would make that call. I would ask them to look if they can include especially people from underprivileged homes. Okay. Like, exactly. I couldn't have been a doctor if I were asked to pay full fees. I mean, I had to push truck to pay my fees. I had to sell water and do all of that. There's no way I could pay a full fee today if I was offered that. Right. And there are people like me in different parts of this country that need to also develop their full potential. So there's a room to consider them.
Well, I think the minister designated did say there's still room to consider.
So we will make that call on him and on His Excellency that it may not be all the students, because in medical school, clearly there are people who have the money who are willing to pay. But they're not even getting the space. But there are also people brilliant, excellent, who do not have the means. But once they gain the admission as regular students, I think their fees can be waived.
I think this is good news for them, because you know they were calling on the government to do something about it this morning.
We'll make the call.
So it's good. And I'm happy that you have said it this morning, that you join them in that call.
It's a justified call, because the fact that you are from an underprivileged home should not deny you access. And these are the people who actually would stay and work.
That's true.
They are the people, if you send them to any village, they will go. Because they are coming from there. But that big man's son who has schooled in the prime schools in Accra, you post that person to Hamlet today, he won't go. He gets there, he cannot make a call because his network is transitioning to Burkina Faso. He will leave the next day.
He will leave. That's so true. Now, Doc, I have to keep, staying on health.
Yes.
I say this because you are very, very vital in the health sector.
Yeah.
There was the introduction of free dialysis for patients who have renal disease. As of now, we don't even know the state of it.
Yes.
And you being a member of Parliament, you being an advocate for everything health, what will you do to support such call? Will you bring it back? Will you try to, should I say, reset it? How is it going to do?
Okay, so you see, government is supposed to be a continuum. And we must take decisions in good faith. And no one should set up your successor to fail. Then you are not a good leader. And you don't front load things to your successor to come and struggle with. Unfortunately, that is what has happened. You know, they did a piloting, and when they did a piloting, initially I was just laughing at it. The first 6-month pilot. When you look at the demography of the people that they selected to benefit for free, totally free, if you understood the numbers, you realize that it was just a political gimmick. because they left out the majority of patients that needed dialysis, because the mean age or the range of age where you get a lot of people needing dialysis, that's from that 18 thereabout to 40 thereabout. We're all cut out. And he said under 18, above 60. That was free. And then these in between, you were giving them some support. Then when you were about leaving power, you said free for everyone. Question is, why didn't you do the free for everyone earlier? We started making this call that dialysis can be seriously subsidized. In other countries, they are able to do it for free, and we should be able to do it here. But they waited to the last minute when they're about going, and they say, we declare it free. So come and see how you manage it. You know, that is very unfair. I just want to put that on record. It's not fair to do that to the next person coming after you. That said, I think that dialysis should be free.
For all?
For all. I think it should be free. We must find a good financing mechanism for it. And I think we must invest. You see, one good reason why it should be free, when the government is bearing that burden, anybody managing the public funds will realize it is better to push more money in the prevention than having many people get into the end stage where we have to put so many people on dialysis. So if you are sitting somewhere, you are managing the government finances, and you know that everybody that gets to end-stage kidney failure, they will have free dialysis, and that is costing you money. Then as a government, you look at how do I prevent people from getting there? How do I decrease the burden of hypertension? How do I decrease the burden of diabetes in the country so that people do not get there? Even when people get there, how do I make kidney transplant available? Because that is a higher cost, one-off, but in the long term, it's cheaper than the people going through dialysis every day. People who get transplant can still remain economically viable and contribute to GDP. People on dialysis, their economic viability is significantly hampered because they have to spend 4 hours, 3 times a week, twice a week on the machine. And after that, they are weak. So they are not able to produce as much as people who have had transplant. So you realize that transplant, in the end, is cheaper to the nation than dialysis. So a government that is trying to manage this, accept that, yes, dialysis should be free and provide the funding, but put more investment in the prevention. So support the research institutions to find out the peculiarity of renal failure in our country. Why are younger people getting renal failure?
Yeah, because the increase is alarming.
It's increasing.
Yeah.
In other places, diabetes, hypertension, the balance of which of these diseases is contributing more in the UK, in Europe, is different from what is happening in Ghana. So what is peculiar about the Ghanaian population? So support research in that direction. Use your sin tax. And when I say sin tax, the tax we are putting on fizzy drinks, tobacco, all of those things, use money from that to promote education on healthy lifestyle, to do screening, to make sure that people promote kidney health. When you do that, the number of people that get to dialysis becomes less. In the long run, it's cheaper for you as a nation, and you have more healthier people working for you. When you go to countries where every birthday of yours, they send you a message, come for your pap test, it's not because the government likes you so much.
Yeah.
But it's in their interest for you to remain healthy.
That's so true.
And I
mean, it never clicked, you know.
Yes.
Because I think a country like UK, anytime you step in there, they want you to do a pap smear test.
So it's just that they just like you. Okay. Which is more beneficial to the state, that you are healthy to work, or you are down with cancer that they have to take care of the treatment. You get it? Okay. So it is in the interest of the state that the people remain healthy and work. We are bringing a 24-hour economy. Sick people cannot work in a 24-hour economy. So if we want to handle this, I think that dialysis must remain free. And if it is free and the government wants to decrease that cost burden, then you have to think outside the box. Okay. That thinking outside the box means that as a minister responsible for health, as someone sitting at the NHIA, as a board chairman or CEO, as an advisor to the president, you would think, how do I decrease the number of people who get to dialysis? Because when they are there, they are sucking our resources. They are not very productive to help us. but they are fellow countrymen. We must take care of them. So let's make sure very few people get there.
Wow.
And that's education,
Wow.
health promotion, and all of that.
Wow.
So that's how I think
That's
we should
deep.
pursue. And for funding, I'm sure the new Minister of Health is very good and conversant with this field. We have pledged as a party that we are going to uncap the NHIS. So if we uncap the NHIL,
Right.
money will be available to the authority. And preliminary data that I'm seeing suggests that with the figures we have, government can support free dialysis.
Oh, that's nice.
I think they
So if government can, then we have our fingers crossed that government will. What about the children who have cancer? I think there was free treatment for children with cancer as well.
Well, it's not completely free, but some childhood cancers have been loaded onto the NHIA product of services that are available. And now ask that more be added, because childhood cancers are cancers with a lot of hope, more than that of adults. Many childhood cancers are curable. And these children have several years to work for the state, to be productive for the state. So if you can cure 10 children who will become doctors, lawyers, bankers, who will become business moguls that will contribute to the nation, why not? So I think that it is something to consider seriously. A lot of the childhood cancers are already on the National Health Insurance Scheme, and it's just about making more money accessible. And I keep saying that one of the greatest sins that the elsewise administration did to this country was capping the NHIL. You know, where monies we have all contributed for our healthcare is ceded to the central government, consolidated fund, and then they use it for whatever they wish to use for. That is not a fair bargain. That was not what we agreed. So if I contribute my SNIT to NHIS, I buy something, there's an NHIL of 2.5 on it, it should go towards healthcare. So once that money is available and judiciously managed, I think that we should be able to handle that.
And the truth of the matter is that we do pay NHIL. Even if you go to the restaurant, you pay. When you buy food, you pay. So we pay, probably in a day, you're paying about 200 or 300 cedis for NHIL, and you don't even know you are.
Everybody. That is the basis behind one of the policies the NDC decided that we are going to introduce. That's our free primary healthcare. When we say we're going to offer free primary healthcare, people were like, why?
Tell us more about the free primary healthcare.
So the free primary healthcare is going to make healthcare at the lowest level, CHIPS compound, a health center.
But the CHIPS compounds, a lot have been built by the NPP.
Yes. Oh, we built more.
You built more?
We built more.
Okay.
In fact, the number of functional CHIPS compounds contracted by over 1,000 during the NPP era. But granted, we are in power and we are willing to move on. We are going to pick up whatever has been left over and we'll continue. But we are saying that nobody going to the CHIPS compound in my village in Kucha this morning, or going to the CHIPS compound in Bilo this morning, or Hamley or somewhere else that does not have the health insurance should be denied care. Truth is that they are all contributing to the NHI. As you have said, if you go to a restaurant, you pay. You buy something, there's an NHIL on it. So everybody is contributing something into that kitty. Why should the absence of the card deny you the lowest of care? So every Ghanaian should be entitled to that lower bit of care. Then your card becomes additional for you when you go to the higher centers of care, like the regional hospital, like the tertiary hospital. Then it is very important. So making free primary healthcare will not collapse the NHIS. No. It will rather make sure that people try to get the card for the higher level care. So when you are referred that you need a surgery at your regional hospital, district hospital, you probably need your NHIS card to help you. But for all the contributions you do, for all the contributions we all do, whether you have the card or not, you must benefit a certain minimum package. And that's why His Excellency says, if we want to have universal access, universal coverage of healthcare, then the lowest level, which is the CHIPS compound, that is closer to everybody, should be free to everyone.
I like that. So your government has promised a lot.
Yes.
A lot. Ghanaians are, expecting nothing but what you've promised. In the next 2 years, what do you hope to see the health sector looking like
Okay.
by your government?
So I am very hopeful, and my hope is premised on the person leading us, His Excellency John Dramani Mahama, who is an honest and sincere person, true and faithful to his word. I am also hopeful for the health sector because of the person that has been nominated as the health minister, who seems to know and knows quite well in the space. So on the basis of this and the promises made, I think that in the next 2 years, we should see a rollout of this free primary healthcare where everybody in Ghana, in any community, can access healthcare for free at that level. I expect that we will see some effort towards health tourism, which we believe can actually reverse brain drain to become brain gain.
Okay. Health tourism.
Yes.
Which one is that one?
So we are looking at trying to elevate our medical care to such a point that people travel from outside of this country to Ghana to seek care.
Okay. Like what South Africa has done.
Exactly.
Okay.
And then you will have fine specialists in different parts of the world also coming to Ghana to offer that care. Because if I am a plastic surgeon and I will do a surgery in the US and the surgery will cost $200,000 and the state will take $100,000 and federal taxes will come in and I end up with $20,000 and I come and do that surgery in Ghana and maybe I'll earn more than that and the taxes are not that much, I'll probably come here. Maybe when I come here, I'll get 10 cases at a go. In the US, I'll get only one, maybe in 3 months or a year. So we have several comparative advantages. Our location is unique. So if we have more places like the UGMC and we have hospitals that offer that level of care within the sub-region, we are gone. If you're able to put up our ultra-modern children's specialist hospital, 500-bed capacity children's hospital we are talking about, there's only one of its kind in South Africa, the Red Cross War Memorial Hospital.
Yeah.
If we have that in Ghana, training is up there. People from other parts of the region will come here to train, and they are going to pay us in dollars. We'll make money. So health then become not just a net gainer, but it's also contributing to GDP.
So all of this in 2 years?
No, that's something I'm expecting to see that will begin.
Begin in 2 years. Okay,
Yes.
All right.
So once that begin, then we realize that we are working towards our goal.
Okay.
I'm expecting that we can roll out some policies to work on our brain drain. Not to stop it, but to manage it so that it is ethical. So those who want to go can go. Those who want to stay can stay. And those who stay should be happy staying.
And I think that there's also a fertility hospital that you are going to build,
Yes,
right?
So that is linked to that children's hospital.
Okay.
Yeah, it's supposed to be in the same structure. So I expect to see these things starting.
So should we expect more ultra-modern hospitals than these Agenda 111 hospitals?
So, well, we didn't promise so many hospitals like this number of Agenda 111. We mentioned the...
More chip compounds?
Yes, more chip compounds.
Okay.
And then upgrade of some existing facilities.
Okay.
Like Kolebu, like Konfanochi, to a level where they can also offer services like the UGMC. Because Kolebu has the human resource higher than UGMC, but in terms of material resources, not as much as the UGMC. So if we are able to equip them well, they can function higher. And that will be good for our health tourism bit. So we are looking at the human resource bit. The quality of healthcare must improve. We want to see that emergency care is better managed. I
was just going to go on the emergency care
think that
because of this ambulance and all of that.
Exactly.
Emergency care is low, very low.
It's dangerous, my dear. If it doesn't scare anybody, then nothing else will scare you.
Yeah.
You know, for cold cases, you can have a choice that I want to go to a private hospital. I want to go to that hospital. I want to see which doctor is taking care of me. But in an emergency, you don't have a choice.
No.
So, and it's a leveler. Emergency is no respecter of person. It can happen to anyone, anywhere. So you should not be in an emergency and be told there is no bed. That is unacceptable. And it's one thing I'm going to talk to the new health minister to really work on. And we'll use parliamentary oversight to ensure that we should have a proper bed bureau management system that with IT backed, that you can tell a doctor in any private public hospital at the click of a button should be able to tell that if I need a bed for someone in Kolebu who needs oxygen, they have 2 available. 37 has this number available. Rich Hospital has this number available. And that is not far-fetched. It can easily be done.
Right.
So we need to improve our emergency. We should get to that point where drivers at the lorry station are trained on basic life support. They can do CPR. You know, we should have AEDs, automated external defibrillator.
We are hoping that, you know, there will be people who go out there to train drivers and all on CPR.
Yes.
Okay.
But the National Ambulance Service is the agency responsible for that in law. But how many paramedics do we have? We have 1 paramedic to about 95,000 population in Ghana.